My name is Joan Coulafay. I attained a Master of Science in Equine Science from the University of Edinburgh, and I received a second Master of Science in Clinical Pain Management. I joined the ECIR group in 2007. Laminitis is a very painful condition, but it's compounded by other body pain associated with that occurs at the same time besides just the laminitis. This breakout session will talk about the other body pains that are occurring besides just the laminitis pain itself. With laminitis, it usually happens in the front feet, and you have very painful front feet going on. And the horse tries to get away from the painful front feet by compensating by shifting backwards. Anybody who's ever been on crutches knows that when you first go on crutches, oh, everything's fine and dandy, you're quite happy. But by the end of the day, you find that your hip on the other side is very, very painful from compensating, and you find that your biceps are killing you by the end of the day. Horses have the same thing. They go ahead and they try to get off their front feet. They rock to their back feet. And then before very long, their front feet are very painful, but their rump muscles and across their back are really, really sore and painful. And you say, so how can I go ahead and help the horse when they're standing like this to go ahead and be able to give those muscles some relief? You can help the horse by giving the horse deep bedding. Deep bedding goes ahead and provides cushioning for the body. It encourages the horse to lay down, which gives the sore feet a break, and the poor muscles, it gives them a rest. And it also gives you plenty of protection from the cold ground. The difference between the surface of the ground compared to the top of the shavings can be 10 degrees or more differential between the two. Supplements might also be helpful for horses with sore muscles. Things like omega-3s, like in flaxseed or chia, magnesium can go ahead. Those can help the muscles. For the pain associated with those muscles, there's a host of supplements that may be helpful. Devil's claw, boswellia, acetyl-L-carnitine, MSM, ultramicronized PEA, turmeric. There are others, but those are the most popular ones. It's also real important to know that when you're feeding your horse, if you throw the hay on the ground in front of the horse and the horse is standing, they have to reach down over their front end to be able to reach the hay. That means instead of shifting the weight to the back end, they have to shift their weight onto the sore front feet. And so it's kind to be able to go ahead and hang a hay net so that the horse doesn't have to go ahead and reach down. Of course, if your horse is laying down because they have sore front feet, it's helpful to go ahead and have the feed right there next to them so that they don't even need to get up. It's like if they're doing an extensive time period of laying down. Of course, as they're laying down or if they're standing up, you find that boots frequently help very painful feet. But it's important to watch for boot rubs. We sort of minimize boot rubs because we don't think that they're nearly as painful as laminitis, and it's not. But anybody who has worn new shoes and got a blister at their heel knows how painful that is. And in this case, you can see where Misty was not too happy with having a boot on, and she was determined to try to take it off. So we say, yes, laying down is helpful to your horse. But there's pain associated with laying down. One of the big things you have to watch for is for pressure sores. Common places are the fetlock joint and the hocks. The fetlock is the fibrous capsule is very tenacious and it's really tough, but still you can get a pressure sore that is so deep that it actually goes through the joint capsule and it invades the joint capsule. When that happens, you get a septic joint and you have a whole host of other problems besides laminitis. How can you help the horse? Standing wraps is an excellent way to do it. And if you look at the center picture, you see that with the standing wrap, they actually went ahead and dropped the wrap so that it goes to the very top of the hoof. When you lower it like that, it gives excellent protection on it's like for the fetlock. Of course, there's also fetlock shields available. There's hawk shields available. And if you don't have those and you're worried about a pressure sore on the fetlock, you can always use an upside down bell boot. Most people have bell boots floating around. It doesn't give perfect protection, but it gives better protection than nothing. You also have pain associated with laying on large muscle groups. You say, Joan, how do we know this? The horse can't go ahead and tell you, oh, I'm sore because I'm laying on my muscles. We know this because you can do blood work and you see that there's elevated CK, and that indicates that there's muscle damage. Muscle damage equals pain. So in this instance, you can see the horse goes ahead and has a skin wound from where the horse was laying down, but you can also have the skin totally intact and still have muscle damage underneath just from the weight of the horse. There's also cold-associated pain, and cold-associated pain occurs in two different ways. One is it goes ahead and you have body pain from the cold, and the other is you have hoof and foot and leg pain. The cold associated pain associated with the body frequently occurs because the horse isn't moving around enough to create heat with the muscles. For cold associated pain with the feet and the legs, the nerve endings are actually irritated because it's so cold. And in this case, boots and socks can go ahead and help preserve enough of the body heat in the blood flow that goes to the feet to go ahead and help relieve some of the pain in the heat in the legs and feet. How can you help the horse? If the horse is having body pain, you blanket the horse to help the horse out. It's not unusual, besides not enough movement, for horses with laminitis. If they're older horses, they've lost body condition, they may have PPID, and they may have trouble thermoregulating anyway. So a horse that never needed to be blanketed when they were younger may need to be blanketed. Also, bedding helps keep them off the cold ground. And of course, shelter from the wind and the elements is also helpful. There are supplements around that can possibly help with cold-induced pain. Jalgulin is one of them, acetyl-L-carnitine, and AAKG are common supplements for cold-induced pain. When you have laminitis, you also frequently have arthritis flares. And the arthritis flares can be very debilitating. What ends up happening is you find that the horses move less. Anybody who has knee arthritis or hip arthritis knows when they hop out of bed first thing in the morning, the first 5 steps, they say, "Oh my goodness." And then all of a sudden, as you walk a bit more, then you warm up out of it, and then you're sort of okay. Well, horses, it's not unusual for them to have hock arthritis, and it usually takes 5 to 10 minutes, maybe 15 minutes of walking to warm up out of hock arthritis. but laminitic horses can't walk that much to go ahead and warm up out of it. The other reason why we find that we would think arthritis flares are worse is because of a human study that was done. They went ahead and they got a group of people who had hyperinsulinemia but not high glucose levels. So that's sort of what you find in horses. And they went ahead and they had the group and they pulled together the group of people who had knee arthritis. They compared it to people who had normal insulin levels. And they said, what's the level of pain that you have? And the people with normal insulin levels had less knee pain compared to the people who had elevated insulin levels. So somehow the elevated insulin seems to increase the perception of pain itself. So it's not unusual to think that that can also occur in a horse. There's tons of supplements out there that can help support a horse with arthritis. Acetyl L-carnitine, boswellia, movies, hyaluronic acid, MSM, devil's claw, just to name a few. So you say, Joan, why would we address these other pain issues? Why even go there when we know laminitis is the big pain insider for the horse? Because pain is designed so that when you put your hand on a hot stove, you pull your hand away before you damage your hand. And that's ideally what pain is supposed to be about. But because you have muscle pain, wound pain, cold and joint pain, with laminitis, these are not therapeutically helpful to the horse. So what does this mean? Pain can cause hypersensitivity. So it lowers the threshold. And so what does this mean? Painful stimulation, it makes you register that the pain is more painful than it otherwise would be. It also goes ahead and it makes it so that it's painful in the area around where the wound actually is, the painful area. And an instance of this is if you sprain your ankle really badly, by the end of the day, your knee hurts, even though your knee was perfectly fine, wasn't injured at all. And the third thing that it does is it can cause non-painful stimulation to be perceived as painful. This happens, a horse will say, don't brush me, your curry comb is too stiff, ouch, that hurts, don't touch me. They have the touch me knots. And this is important if you're going to have body work done on your horse, that they may not appreciate a horsey massage because that is perceived as painful instead of feeling good. The other thing that this can happen, that you address these, is because what you don't want to have happen is you don't want chronic or neuropathic pain. This is extremely difficult to treat because the nerve physically changes and is physically damaged compared to a regular nerve. It's extremely tenacious and it can lead to complex regional pain syndrome. There are supplements that help in some cases, acetyl L-carnitine, ultramicronized PEA, turmeric, but in general, those are woefully inadequate. They really can't address it significantly enough. In humans, they frequently go to gabapentin, and in humans, you also go ahead and then jump into opioids when you have this situation. What you find is fear exacerbates the pain that you have. It gives you a heightened awareness, and that heightened awareness increases your pain because you're very aware of what's going on. And in the big picture with this, if you have the horse in a dry lot and you have a goat in a dry lot, the horse is not going to say, oh, no big deal. There's a predator out there, but he's going to eat the goat first. Instead, the horse says, I can't get away. I can't run. I can't protect myself. I'm the next one that the predator is going to eat. So that causes a heightened fear response in the horse. How can you address this? You can address this by going ahead and putting the horse in a stall so that with deep bedding so they can lay down, and be sure to have a stall door instead of a stall gate so that the horse knows that it's safe, that no predator is going to sneak underneath the door and get him. But then you put them in the stall, and social isolation exacerbates pain also because horses are herd animals. Horses are always in a herd. Even when the young boys are forced out of the herd because they're starting to mature, they join the bachelor band. They don't go ahead and just wander off through the desert by themselves. And social isolation makes the horse feel vulnerable, increases the fear. So when you address something like this, if you have the horse in a stall, to go ahead and make sure the horse has a buddy around. If the horse is in a dry lot, make sure that the horse has a buddy who's not going to push them around, but so that they know they're not alone, that they're part of a small herd. What you also find is distraction helps. Anybody who's had a child with a broken arm knows that they cry and cry and cry that their arm hurts, that it's just terrible. However, if you hand them an iPad, what you find is before very long, the tears sort of dry up, they're busy playing their game, and they can go for hours without whining or complaining about the pain in their arm. And the same is true for humans, for adults also. My sister Marilyn went ahead and fractured her ankle when she came to my graduation at Edinburgh, and she had 2 rods placed in her legs. When she went back to the apartment, she had minimal pain meds because she was playing a game she was engrossed in for about 4 days on her iPad during the most painful time period. And so distraction does go ahead and help. Distraction helps for our horses too. When they know that you're there, when they know that you care about them, they go ahead and they focus on you instead of focusing on their painful feet. And in a situation like this, if you've ever been to an equine hospital, what they find is horses that have had surgery, they always do so much better, and they have a brighter attitude when their owner comes to visit them or their carer comes to visit them, and because suddenly they have something to look forward to, and they're suddenly no longer focused on their pain. If the horse is painful, it's important to remember not to take your emotional baggage with you. Instead, say, "Oh, honey, don't worry, you'll feel better tomorrow." Even if it's not going to be tomorrow, but tomorrow's tomorrow, or tomorrow's tomorrow, sort of thing. They know that you understand, and they're not having to deal with your pain issues. So to recap, what you find is we have associated pain from compensation. We have muscle pain. We have pressure sores. We have joint pain. We have disruptions of daily living. All of these go ahead and factor into who your horse is and what they perceive. The goal is to help the horse return to normal functioning as soon as possible. So although we address all these other issues, we have to address the underlying issue first. So if your horse has laminitis, address the high insulin levels through diet, through metformin, through SGLT2 inhibitors. Address PPID if that's the case, and trial pergolide even if you don't know, even if you can't test. Ask your vet for a trial of pergolide. Because the goal is get your horse to being normal as quickly as possible so that then you can go ahead, you can avoid the whole sequelae of what happens with chronic pain, chronic regional pain syndrome, complex regional pain syndrome. So it looks as though we're to the end. Thank you very much for going ahead and joining this webinar. And I've loved the conference. It has been so fun. And thank you very much. And enjoy the rest of the conference.